All right, let's go ahead and get started. Good morning or afternoon to everyone, depending on where you are in the country, and thanks for joining us today. My name is Marc Scher, and I'm the chair of the Healthcare Financial Management Association, and prior to that, spent 40 years at KPMG, where I served as the partner in charge of KPMG's global and U.S. healthcare audit practice, and I'm going to serve as our moderator today. Our webinar today is focused on the financial strategies for addressing climate change impacts, decarbonization, and the cost of inaction in this space. We have with us today three speakers. You'll see them here in a minute: Niyum, Brandon, and Rob, all of which serve with healthcare organizations that are actively working on projects that are not only addressing climate change, but also focused on reducing the volatility and inflation of energy costs. I'm going to turn it over to the speakers right now to introduce themselves. Niyum, can we start with you?
Great. Thanks so much, Marc. Great to be with you all. Thank you for taking the time today to spend with us on this important topic. Niyum Gandhi, I'm the CFO at Mass General Brigham, a large academic health system based in Boston, and I also chair our Climate Sustainability Leadership Council here.
Thanks. Brandon?
Hey everybody, Brandon Seibold, Adventist Health, the Senior Finance Officer and Treasurer here at the organization. Adventist Health covers really the West Coast, so $8 billion in revenue, hospitals in California, Oregon, and Hawaii.
All right, thanks. And Rob?
Hello, everyone. My name is Rob Roy. I'm the Senior Vice President, Chief Investment Officer for AdventHealth. I also lead our retirement programs, and I'm the co-head of environmental sustainability for our organization. We are 55 hospitals in 9 states, sister organization to Brandon's on the West Coast, but covering more of the sort of central part of the United States. It's great to be with you all today.
So today we're going to share with you the journey each of these organizations have been on to achieve their goals in this area. And as part of the roundtable, we're going to walk you through what motivated each of the organizations to take on this initiative, the research and findings they did as a basis for determining how best to address the issue, the approach used to restructure their overall energy strategy, and what the expected results of these projects are going to be. Our overall goal is to provide you with some thoughts and a framework to assist you if you're interested in establishing an energy strategy for yourself. We're going to have about 20 minutes for our roundtable discussion. Then we're going to open it up for questions, which you can enter into the Q&A feature at the bottom of the screen. So let's go ahead and get started. I think we're going to start with motivation. What motivated your organizations to take on this initiative? And was there any specific moment, challenge, or opportunity that served as the catalyst for that initiative? And let's go ahead and start with Niyum.
All right, thanks, Marc. Maybe just starting at a macro level. I mean, I think our overall motivation here, which is probably consistent for a lot of organizations who are engaged in this work, and we're all parts of our mission, our clinical care, community health, research, and education missions are all focused on improving human health. And climate sustainability is a public health crisis. So for us, the motivation, the broad-based motivation across the organization is addressing our impact on a public health crisis and ensuring that we're doing the best that we can to be responsible stewards of the climate and the environment to help promote human health more broadly. Then, if I think more tactically about it, what that led to for our organization was a lot of really great work happening, I'd say kind of grassroots and bottom up across the organization. We have a lot of leaders, especially physician leaders in our organization who are thought leaders in the space and have done great research on the impact of climate on health, climate sustainability initiatives, environmental harm reduction strategies. And really, as our organization a few years ago started shifting from a holding company model to an operating company model across all aspects of our strategy, we pulled together those efforts in climate as well to have an overarching strategy and approach to addressing our impact on climate more broadly across the organization. Kind of everything from measurement to to kind of action and beyond. But But that motivation, the underlying motivation of addressing a great human health challenge is probably the thing that's been persistent throughout the various phases of our work.
Brandon?
Yeah, no, that's super helpful to kind of hear how you guys thought about it. I think that is similar thinking at a macro level to how Adventist Health thought about it, just in terms of kind of our mission as living God's love by inspiring health, wholeness, and hope. And this is, prolonging that and improving that over kind of two facets. I think the one thing that I'd add slightly different in terms of how we thought about it is we were driven somewhat by the economics around the value of investing in improved kind of energy efficiency. So that's kind of where a lot of our kind of original thesis and conversation started. And in particular, in California, you have very high utility rates, some of the highest in the nation. And we saw, actually 2 years ago, we saw a 12% increase in our utilities from a single utility provider. So that I think drove kind of our thinking around the economics. And so then we were able to kind of piece through, where do we get the highest and best return as we think about investing in energy infrastructure. And so we pieced through investing in solar strategies with investment tax credits, investing in battery strategies, investing in improvements in our building automation systems across the organization, improvements in our central utility plants, kind of all of the spectrum in terms of where we chose to make those investments. I think the secondary thing that when we went into it, we didn't appreciate the value of was investing in those assets also improves the reliability of them so that we have, good patient experiences in terms of our highly functional kind of utilities. It sounds basic, but if you think about it, in California, we have rolling blackouts on occasion, in particular with windstorms and those type of things. Well, we were able to invest in generators in those clinics so that we could continue to provide patient care in those spaces. So kind of those were the two benefits we thought about it in terms of economics, and then secondarily, look at
cover. Hold on. Shaking expected.
Sorry about that. Earthquake notice here in California.
there you go.
Here it comes. Yeah.
Power's going to go out. Yeah. So those were kind of the two ways that we thought about it. So.
Whoa.
Where are you, Mark?
I'm in Laguna Beach.
Wow.
Wow. That was a big earthquake. All right. Sorry about that.
Okay, I don't think I've done a webinar with the host being in the midst of an earthquake before. Well, if we lose you, we'll try to pitch it for you. We've got the questions as the backup. We care about you first and foremost, but we will cover the questions if we lose you for some reason, Mark.
I think we're fine. Yep.
Okay. Now, I love this opening question because it's really this high-level motivation. And I think what it should show to the people that are watching the webinar is that finding your way into this work can come from a number of different places. It's not just one direction, right? We all have these different lived experiences. For AdventHealth, I think part of it started from what I'd been doing. So for most of my career, I've been the chief investment officer at AdventHealth. And what I'd seen was that many of my peers, like investors at endowments and foundations, were going through a period where their stakeholders started to create new expectations for how that money was being managed. And while I knew that healthcare didn't have the same pressure from patients necessarily, there was this rolling new set of expectations that were coming towards large organizations to say, there's plenty of problems in the world. I know you have a core mission, but in what other ways could you be a benefit to society? So expectations would be changing from our team members who were part of our organization, from the communities in which we operate, and ultimately from our patients. And that drove us to say, instead of hey, let's focus on decarbonizing, what we said was we really need a structured framework for how we're going to think about all of these issues, whether or not it's environmental sustainability or human sustainability or whatever. And so our board, in updating their enterprise risk management framework, made this request for a framework for how we would think about this, one of the top 10 items for the organization. So it really started at the board level as almost a blank sheet of paper, just saying, we know the world is changing. Let's not be reactive, let's be proactive. From that grew this work around environmental, but it was one of the items that came from that broader sort of blank sheet of paper realization that expectations in the world were changing.
I think that's amazing. So we have a lot of different motivations, some tied directly to missions, some to sustainability, and some to being proactive. So I think there's a lot of different ways organizations may be motivated to head in this space. I think it would be helpful to maybe talk about the research and the findings. So what kind of research or analysis did your organizations conduct to understand the risks and opportunities related to the energy strategy and climate change? And were there any surprising findings? So let's go ahead and start with Niyum again.
We did, I'd say our research kind of went along two different tracks. One was maybe a narrow piece, kind of related to what Brandon was talking about. We did an assessment on the cost issues, right? And part of this was kind of creating the financial grounding for what's going on from an energy standpoint, where if we engage in the right activities to reduce energy utilization, can we drive kind of immediate return on investment? And part of this is kind of grounded in the approach that we use for most mission related investments. We kind of break them into things that have a financial ROI and things that don't, not because one is more important than the other, but because anything we can invest in that has a financial ROI just creates more funding to invest back in the mission, right? In any part of the mission. So, and then on the things that don't have a financial ROI, it is, there's a trade-off of how much you can invest. If we could invest, $12 and get our emissions down to zero, I'd write the check tomorrow. If it cost, $12 billion, that would bankrupt the organization. And so, so it's kind of always done in that sort of calibration mindset. But we did an assessment on kind of the energy savings piece and kind of could build a self-funding ROI model for some of the things that had financial benefit. The other big area of investigation over the past couple of years was really just getting a sense of, and we're probably a little bit behind some other organizations on this because of how we used to be run kind of in separate little subunits across our organization, but just getting a comprehensive view on our emissions overall. And so we did a greenhouse gas inventory audit, looked across scope 1, 2, 3, all of our areas of emissions, and identified, where we're in kind of line with the industry, where we're ahead, where we're behind. And there are a mix of different areas like that. And that allowed us to then start to develop our strategies to address the biggest drivers of impact, rather than just saying, that there's a lot of good activity around X, but if X isn't really a big problem for us, or it's just a very, very small piece of the problem for us, while that may make us feel good, let's go tackle the bigger drivers of emissions, or at least the places where we're larger outliers. And I think, maybe in terms of answering your question about findings there, I wouldn't say anything terribly surprising. I think for most healthcare organizations, and I imagine all of those, kind of on the call here are in a similar situation, there's nothing that really jumps out, as particularly different from one organization to another. The biggest drivers are kind of the same for all of us. I think highlighting how big of an issue scope 3 emissions was an important learning for people who are further away from the work. I think people who are close to the work understand that scope 3 emissions are going to be 70-80% of our total emissions. I think people who are far away from the work don't realize that immediately. And so being able to shine a little bit of a brighter light on that, I think, helped with a lot of our kind of pulling groups together to address the challenges more broadly.
Thanks. Brandon.
Yeah, so just following on to Niyum's point on the economics and the ROI, I think I would say if I step back over the last 5 or 6 years, Adventist Health has been doing the right thing in terms of investing in energy infrastructure, adding solar to pretty much all of our campuses, adding battery storage to a number of our campuses. But we hadn't organized kind of a model that worked across the system for all of the campuses in a kind of cohesive way that we could demonstrate to both our internal stakeholders as well as our external stakeholders what the intentionality is in terms of those investments and what the value, both from an economic perspective as well as a return perspective and a kind of improving or hardening our infrastructure, reducing kind of deferred maintenance type of things. So we went through a very detailed analysis, market, hospital by hospital, building by building, to create where if we invested in this solar project, what was the return at this specific campus? If we invested in building automation systems to improve or to decrease our airflow in certain unused parts of the building, what would be the value of those investments, and went kind of a very granular level, and then built up to what the system kind of model was. And I think maybe the interesting thing that we learned in that is there's some campuses that were newer and maybe didn't need as much investment, but we could make investments there that would generate returns that we could utilize kind of across the system to invest in other campuses that were maybe a little bit older and needed more investment to improve kind of their energy efficiency. So I think that's kind of some of the research that we did entering into kind of our kind of layer of energy improvement across the system.
Thanks. Ron?
Yeah, again, it's so interesting to hear different people's perspectives. Each organization has a unique culture, and those of us that are called to lead this work, part of our effectiveness is that we understand the culture of our organizations and we know how to operate effectively within them. And so for each of you, these aren't prescriptive in terms of like do what we did, but you're hearing different versions of the story. And so much like what Niyum said, we started from a measurement perspective. When Marisa Faribaugh and I were chosen to lead the environmental sustainability work, we were chosen because we're both finance people at heart. She leads supply chain, I lead investments and retirement programs. We're both quantitative. She's an engineer by background. I'm math and finance. And so what they said was, you guys were picked because we knew that you would think through the framework and not just do a bunch of cool projects that didn't really, add up to a cohesive answer to the issue. And so we started by measuring, and to Niyum's point, it's the surprising element is how big is scope 3 as a part of that. Of total emissions, I'd say close to half is from financed emissions, so coming out of your investment portfolio. About a third or so is from supply chain. And then the last 15 is really in scope 1 and 2, and most of that's scope 2. So once we knew what the lay of the land was, then interpreting through our corporate culture, we knew that to start the work, there was a desire to do the biggest things first. It turns out that the biggest things, like attacking purchased electricity, are also things that you can do at the corporate level where you don't need buy-in from all of your employees or all of your different hospitals. That those kinds of power purchase agreements are done at the corporate level. And so we started with things that we could really take a big crack at early in the work. Also, to Niyum's point, those things have been financially accretive. And so it created momentum around the work. Then that we had a good sense of what we were facing. We knew the priority of what to do. And the things that we were starting to uncover were both environmentally and financially accretive. And that really created momentum to allow us to continue to move that work throughout the organization. The work on scope 1 and 2 now is much better in hand. We believe we're in a good place to reach our targets on scope 1 and 2 emissions probably by the end of this year or the beginning of next year. And it's really going to be the difficult work of attacking scope 3 around supply chain and investments. And that's where we're going to spend a lot more time leaning in. The other thing that we realized as part of the work, Mark, was that if you take a step back, the real goal of the work that we're doing is to try to improve the environment and preserve a place for humans to live. We can't do that work by ourselves. So any one of our organizations doing all of our work perfectly won't get it done. We really need the network effect, which is why events like today are so important. But doing your own work gives you an authentic platform then to go out and have these conversations. And I love having 3 of us on the phone or on the call to show how we've all kind of come at it from different angles and different paths and different cultures. But it's encouraging people, because if we all get involved in this work, that's really where the magic is going to happen.
Great comment on culture and how that can drive the types of research you're doing and ultimately the strategic approach you took. If we could now walk us through the strategy your organization used to restructure its energy and sustainability approach, it would be interesting. And how did you make the case internally, either to the board or your other team members, which would tie into culture? So let's circle back again with Niyum.
So I'd say two things. Maybe starting with how the case was made. I will give a lot of credit to to my colleagues, especially my clinical colleagues, who kind of embody the principle that we've now started using in generating buy-in here, which is co-opting people. And so if you make people part of the effort, they feel accountability and ownership for the effort. And I would say they pulled the first example of this when they co-opted me into leading it. They knew that I was interested in and passionate about the topic. I was new to the organization, and I sat in a position where a lot of the people who needed to be brought in after me, reported into me. I have investments, I have supply chain, I have, kind of core finance, energy, real estate, facilities. So, a set of things where they knew that that kind of leveraging my buy-in would be helpful. And so we worked to create a governance structure that we use to oversee the work, which has basically all the folks that oversee the critical areas that are relevant to our work in climate, but also the places where the tension often lies. So as an example, as we think about moving away from use of disposables to reusables, right? To reduce, both emissions because you're throwing stuff away, but also landfill waste. One of the tension points is infection prevention, right? Are we, as we move to reusables, are we as thorough as it relates to infection standards? And that's always been a sticking point. So our head of infection prevention is on our Climate Sustainability Leadership Council because we want her thinking with both things in her head at the same time. Our supply chain folks are in the group because we want them thinking about the trade-offs between cost and emissions as they're making decisions. And so part of the goal here was to structure it so that it's everybody's work. Now, the risk there is if it's everybody's work, it's nobody's work, right? So we have a governance structure by which we report out on initiatives up to the executive committee, and we make decisions. But we've moved, and this is what we've done in a lot of our missionaries, we've tried to move away from advocacy to accountability, because I think we had a long history in the organization of having this work be advocacy based. People advocate for resources, they advocate for initiatives. They're seen as a them to an us to some other people. And instead we said, no, this is all of our work. We're going to have everybody who pulls the major levers on this, definitionally by their day jobs, they pull the major levers related to a lot of other things in the organization. I think, Rob, similarly to your point, having it co-chaired by the person who leads investments and the person who leads supply chain makes a lot of sense, right? Because you have to serve the many masters of the organization at the same time. And I think that's actually really critical and it's something that's helped us make a little bit more progress than we otherwise would have, which is kind of embedding it into the daily work of the people who are the natural operational owners of the places where these decisions are made. And then supporting those teams through kind of a work team steering team structure to report out on barriers. So as we identify strategic initiatives at the leadership level, commissioning work teams around them, having them move, holding them accountable for making progress, and being available to break through barriers, much like we would with any other sort of, it's the same sort of approach we use for our cost savings initiatives. It's the same sort of approach we use for our clinical improvement initiatives and for kind of anything else we do in the organization. And I should have prefaced all of that by saying, we have way more work ahead of us than we have behind us on this. We're at like year 2 of just thinking about it this way, and we've made this much progress. We have a lot more to do. So I don't need to oversell it, and we are also not at all ashamed to kind of shamelessly pilfer ideas from other organizations that have figured out faster and better ways to do it.
Thanks. Brandon?
Yeah, I think I think I'll take a different approach and kind of talk through the work that we did since we kind of started our work at the management team level and then kind of brought it forward to the board. As we thought about how to bring that story forward to the board, I think the piece that we focused on that I think was interesting, how much the organization kind of appreciated it, was the fact that this work around sustainability could be more than just could address more issues than just kind of reducing emissions and energy savings. We had infrastructure in the facilities that was way past its useful life. And we were able to kind of incorporate that into the strategy so that it both benefited from an economic perspective and a sustainability perspective, but then also took care of kind of tactical needs that some of the markets needed and was needed from a energy infrastructure perspective across the system. And so I think that made it very real for people in terms of kind of the real immediate value that they saw in their kind of respective areas. So take facilities, for example, or take other capital needs across the system. And so I think that got people really engaged in the way that we approached it. Now, it's a little different than kind of how Niyum and Rob have thought about it, but that was something that we worked through. So,
Rob, anything to add?
Yeah, I mean, I like what Brandon's saying, that there are other effects. Like, I always note that we're on the lookout for every project that could be financially and environmentally accretive. But it turns out that many of those kinds of projects that will satisfy both of those also have further effects, right? So to Brandon's point, it made their infrastructure more robust. It made them be able to have a higher confidence that they could operate in their communities without disruption. We also find significant uptake from our employees and team member engagement. HR is telling us that this impacts hiring and turnover and things like that. People feel proud to work for an organization that is engaged in doing the work that they find to be important. And I'd say many, if not most people, find this work to be critical, especially for organizations that are dedicated to the health of their communities. I mean, that's just such a close tie-in to what our core mission is. Going back to Niyum's point, on strategy, you do want to have the owners of the work tied in, but I'm just going to have to deny that we're smart enough to pick the CIO and the chief sustainability officer. We had no idea, literally. Like, we were picked because we were like finance people that could think in frameworks. It was only after we had measured, we're like, wow, actually 85% is up to the two of you to sort out. And we just it was like so fortunate. So if you're starting the work now, if you can get your CFO, your CIO for investments, and your supply chain officer involved from day one, that would be like the biggest win that you could ever imagine. But this work, as it started and it's really gained momentum, caught the attention of our executive committee, who said to us last year, we love this. We now want to continue rolling this out across the organization. Let's make it part of our short-term incentive plan for all of our hospital executives. So we said, wow, this is fantastic that, this has gotten this much appreciation from the executive committee. How about you let us have 2025 to plan it out properly, and then we'll start to implement that in 26. And they said, no, how about you implement it in 25? And so we scrambled and scrambled and scrambled, and we have our plan together. And so this year, 3% of all of the hospital executives' short-term incentive pay will be tied to submitting environmental sustainability plans for their facilities. So now at each facility, there is a sustainability council that has been stood up. It's an extension of what was previously more engaged around human sustainability. It's expanded to include environmental sustainability now. And one of their directives is by November this year, each one has to submit a plan for environmental sustainability that they will implement in 26. Our corporate team is providing them a playbook and a set of resources and some guidance towards projects that we could be helpful with. But we're not discouraging them from picking their own projects. And this is one of the things that's helping us drive it from a small team of CIO, supply chain, CFO, kind of doing those big ticket corporate-like projects, to now driving that work down throughout our organization and through all of the 100,000 employees that we have across the country.
Well, it's interesting to hear whether it's part of everybody's day-to-day activity or targeted specific projects. It seems to affect the organization overall and help with the mission. So that is, I think, really a bunch of great stories. Want to move on to expected results and outcomes. So you've gone through this process now of coming up with the motivation, doing your research and findings, talking about your strategic approach. What are you expecting the results to be, whether it's financial, environmental, or otherwise, and how are you measuring success? And let's go ahead and start with Niyum again.
Clearly, I drew the short straw by being started with each time. So maybe I'll be brief here on, I think in terms of goals achieved to date, I would say very, very little. Right? I mean, we've made some progress. If we measure our emissions against our, we used like a 2008 or 2010 baseline for the HHS pledge recently, as we looked at, kind of the work over the past decade and a half against that. We've made progress, especially on scope 1. And then, a little more modestly on scope 2, and maybe started to get our arms around scope 3. So we're making progress. We'll hit the HHS pledge dates. I think everybody in this, on this webinar probably will. And that's, kind of a set of dates that we want to make sure we get to that 50% reduction by 2030 and to net zero by 2050. And we're measuring, we'll do, kind of periodic refreshes to track our progress against it. I think there's a set of, maybe I'll use this question as an opportunity to offer something that might be a little contrarian. So yes, I think it is important to measure. You can't manage what you don't measure. And this is a space where, especially because the measurement science is relatively nascent, where I think you could get caught up in spending a lot of time and energy and effort in measuring instead of improving. And so I think it's, and I'll pick on, some of the financed emission space, and Rob will probably be much more nuanced on this one than I am. But the financial services industry isn't built to have perfect look through on this, especially in private assets, right? On the private equity and venture capital side, perfect look through to emissions doesn't exist. Okay, like that's fine. We still have some guiding principles that we can follow to reduce our financed emissions, right? Same thing on supplies. Well, my dream is that when I go into Vizient, I should be able to see emissions right next to the price for every single item. That doesn't exist right now. That doesn't mean we can't make progress. And I think this is a space where, especially thinking about our sponsors here, the National Academy of Medicine, as we think about the progress we can all make together, that there is a desire sometimes to get measurement to the most scientific level of rigor. And, I kind of go back to the whole old accuracy versus precision thing. Is our measurement accurate? Yeah, it's not fundamentally biased to under or over measure. Is it precise? No. Right? Like, could our emissions easily be plus or minus 15% from what we think they are? Sure, probably plus or minus 25, but I don't think that matters, right? And I do sometimes, I would say I'm a little bit frustrated by some of the focus in the industry on. I think it's sometimes used as a cop out. People will say, well, I don't even know if I can measure it, so we won't think about it right now. And again, just because I'm looking at Rob's face here, I'll pick on financed emissions. Like, I know organizations that are just saying, well, we won't even think about that because we can't measure it. And it's like, oh my God, like that is a huge chunk. You can't just ignore it because you can't measure it. You got to be working on it. And it is working on measurement at the same time as management, and recognizing it's messy. It is not a perfect academic science, and there is work that we need to do. So that's not my cop out in saying we aren't measuring, but it's also saying, like, if I'm going to spend an extra dollar to work on climate sustainability, that extra dollar is not going to be spent on measurement today. That extra dollar is going to be spent on a dollar more of work. And we may get to a point where the incremental dollar spent on measurement generates enough insight that the existing dollar spent on management can then have a bigger impact. But you really do need to think about incremental dollar spent or incremental hour of effort spent. And if we spend another 100 hours on measurement, I don't think it's going to have, I don't think we're levered enough up on the measurement to management, kind of spectrum, such that an incremental investment in measurement automatically yields better outcome. I think just working more on it will yield a better outcome right now.
Mark, can I just add to what he's saying before we?
Sure. Yeah, absolutely.
No, that was great, Niyum. And you're right. Like, this stuff isn't super precise. It's accurate, but it's not super precise, and that shouldn't get in the way. I think, the way we've thought about it is that is an evolving area of the work. And so we've partnered with, in our case, we selected Watershed to help lead that. So they're always going to be sort of out there on the forefront, making sure that those methodologies are getting better and whatever reporting we're doing are improving at the pace of what sort of the smartest people in the work are already doing, right? So you partner with someone to help you handle that, and you still realize it's not perfect, but it's their responsibility to make it better each and every day. I also loved what you said about, where you're going to spend an extra dollar, because you've got measurement, you've got action, but we also have all these competing requests to get various levels of certification, whether or not it's a LEED certification or some sort of better buildings thing, or if it's like the Joint Commission, or there is all these sort of like good housekeeping seal of approval things that you can go out and do. And I'm always challenging my team, like, okay, that's great, but like, we have actual work to decarbonize and actual work to go out and talk about it. So where do you want to spend your time? And I agree with you, like, just prioritize that. Doing your own work is probably number one. Helping others engage in that work is probably number two. And then, improving the specificity of your reporting is below that. Certifications and, those kinds of things are even below that. So just staying focused, because there's always going to be more demand than you have resources to supply. So sorry, I just wanted to add on to what you're saying.
Totally
That's
agree.
helpful.
Yeah, I think, Rob, that's where I totally agree. That, we probably spend, well, in California, we're required to measure, right? So that's actually state legislation that they're working on enacting. So that's something that's just a requirement. I think where we're focused on is what can we impact kind of day to day, and really drive true changes in kind of real terms for our respective communities. And even if that's, more focused on scope 2 and less on scope 3, then it's very real to the communities, and we can demonstrate it. So
Great. And so we've had a lot of questions come in, and maybe we can pick up a couple of those. There are a couple of questions asking about the institution getting around short-term annual timeframes and silos of budgeting to make larger investments across silos that will have an ROI over many years, and what kind of ROI models are being used. Can any of you kind of address that?
Well, the only small answer I would give that is get the highest level person like a Niyum that you can get, because he cuts across the silos, right? And my boss is the CFO, and I think that's been one of the most helpful things that we could have is having your CFO be a champion of this work, because silos go away. They all report up to your CFO.
Yeah, I agree. I think on the energy one is a great example. We have a set of initiatives that we invest in every year that we believe to be positive ROI over a short, medium, or long term, specific to energy utilization. We just fund those out of a central cost center and go. And we know that the dollars will land in terms of benefit over a year or two or three at individual parts of the organization. And then it's not subject to, oh, you need to generate the ROI this year to pay for next year's investment or whatever. It's just like, all right, I meet with the energy team. They're showing me great projects. They're showing me things that will have an impact over 3-5 years. Okay, great, authorize it, go. Now again, we have affordability that we have to use to govern the entire portfolio of everything we do. But that's the same as a clinical program, right? If we were launching a new clinical program that had a 3-year, 5-year ROI, we just say, great, we go in eyes wide open and say we're going to invest this, and eventually it'll be a benefit.
Well, Brandon, there's actually a couple specific questions here for you. Who did you go through for the solar and battery, and can you discuss? Hang on a second, I just jumped here. Can you discuss the process and what roadblocks you experienced and what we can prepare for?
Yeah, so this actually complements well to what Niyum just said. If you think about the way health systems allocate capital, everybody has a little bit of a different kind of methodology for how they allocate capital, but at some point there's a finite amount of capital that can be allocated to improve energy infrastructure. And in our organization, I'd say we'd have like a relatively constrained kind of capital capacity. And so what we did in terms of thinking about how we invest in kind of those energy initiatives and our energy infrastructure is we took and we basically said the source of funding for these energy projects will be the savings that we generate from them. And so we built a model that had a projected savings over a kind of a 30-year term, and that savings then matched the kind of funding methodology in terms of how we allocated capital. So the higher the returns for some projects, or the shorter the IRRs, allowed us to then invest in projects that had maybe longer 15-year, like a real example, like with the investment tax credits for the solar, that made those investments very attractive from a return perspective. And then we would take some of that savings and invest in, say, a replacement of a boiler that would have a 20-year type return, but is a good investment of capital. So that's kind of how we thought about it, and we leveraged it, I'd say, more on kind of a project basis. So we leveraged a partner, Bernhard, to support us in terms of the implementation of that work across the system. And so that's kind of how we thought of that.
Thanks. There is a question here asking how each of you measured your emissions. How did you go through that process?
Kind of similar to what folks were talking about in terms of some of the other areas. We worked with a partner on that. We worked with Guidehouse and went through a structured process. A lot of data, took 6 months of time, and again, some of it is accurate but not precise. I saw some comments in the Q&A. I think there's somebody here from Kaiser, one of their former execs has actually joined the Guidehouse team and helps lead that work with health systems around the country. And we had 3 or 4 different organizations we could have picked from. We ended up going with them. So that's not meant as an endorsement necessarily of one organization, but I think it's a relatively small financial lift to bring in a partner to help walk you through how to measure your emissions. And I think it's worthwhile just going with one of the 3 to 5 out there who have probably done this work for 50 to 100 health systems each.
So we actually had 2 different
Yeah,
people ask. Oh, was there another comment? Okay.
Well, I was just going to say, we did something similar. We partnered with Deloitte, and the difficult lift the first time around is emissions data is all over your organization. You don't even know where it is or what to ask for, the quality of it, and who to get it from, what form it's going to be in. So year one, the messiness is really your organization has never done this, so it's never collected it, and it doesn't kind of know where to source it. But as you get that data, your guide, Deloitte, Guidehouse, there's a number that Niyum said you could connect with. They help you figure out what data do you need and where might you find that in your organization. But the method you apply to calculating it is not something you have to make up. Like that's pretty well structured. There's existing GHG methodologies that sort of ingest this data that you need and create those calculations. Then we went one step further and said, we realize this isn't a one-time project, and I don't want to go through what we just went through again. Let's bring in a partner to start automating these bits of data to come in. And that's where our friends at Watershed really started to automate the ingestion of that data. And then also say, we'll be on the forefront. So as methodologies are improving, we're always going to be, bringing you along that journey of improving that methodology. So it's messy. It's a big lift in the first year, but it's not something you have to figure out on your own.
Right. There's 2 questions here that are related to how much of your actions involved pilot projects demonstrating cost savings and decreases in greenhouse gas emissions. Ties into, I think, what you were just talking about. Were there a number of pilot programs, or did you just launch?
We did some just big things right out of the gate. I mean, it's kind of our culture to figure out the landscape, figure out where the big rocks are, and then go take on the big rocks. Like, let's make actual progress as quickly as possible. And so, having a board and a CEO, but most importantly, a CFO that was really passionate about it, made sure that we were putting the rigor into the financial side of it. But once we had the right partners and we had the right models to demonstrate where the value is going to come from, it was making me laugh when Niyum was describing, like, you just do these things and go, spend the money, let's go, let's get it done, right? That's the power of your CFO. If you can satisfy them that you've got the right level of detail and understanding and models and approach, you're going to get greenlit for it. And so we really kind of started with the big things first, and our culture didn't start by piloting smaller things and moving up, but that's just us.
Somebody had mentioned the benefits to morale. There is a question here if anybody's been able to quantify the benefits to staff recruitment, retention, and morale given these initiatives.
I was in a meeting with Deloitte on Friday, and they told me that's actually one of the easier things to measure. I'm like a finance guy, and I was like, okay, well, I really want you to show me that, because I think that would be a really important part of the story, but I can't conceptualize how you would do that. But they're insisting to me that that's something that they have really good processes around, and that they're going to help us start to measure. So I'm excited, but I have nothing specific to share with you at the moment.
Yeah, same here. Actually, I've heard similar things, Rob, and I've started to poke at it. And so maybe Mark and our NAM colleagues could be a topic for a future webinar here. It did highlight, when I first heard that, though, it highlighted to me one of the gaps that we have, which is we've historically done a terrible job communicating the work that we're doing to our employees on this front. And that's something and again, it goes back to our heritage as a holding company where we didn't really do communications in kind of a structured cascade down manner from the top of the organization. But it's why it's actually of our of our 7 key initiatives for the remainder of this fiscal year, which is another 5.5 months here. Internal communications is one of our 7 key initiatives for our sustainability work, just simply because we realized how gapped we are on it. And that's not our comms team's fault at all. Actually, they're fantastic once they get plugged in. It's just like we don't have the operating processes by which to tee up, hey, this is a new initiative that we started. This was the impact. This is how it was good for the community. And without that, then we have employees reaching out, sometimes very well-intentioned, saying, hey, I read this article about this such and such that some other hospital is doing. Why aren't we doing stuff like that? It's like, wait, what are you talking about? We're doing a ton of that. We just aren't telling you. Oops, that's on us. That's our fault.
Well, I'll make you feel better. We realized about 6 months ago that our external presence in this work was much bigger than our internal presence. And so we have just maybe 3 weeks ago brought on a dedicated communications resource for environmental sustainability to be able to tell that. And the other thing that really got me excited was about a month ago, we had a sort of a visioning lab day with Deloitte, where we brought in leaders from across the organization that are helping us with this work. And at the end of the day, one of the most senior people in the room said, this is going to be very accretive to our brand. And I was like, yes, yes, it is. Let's start telling our communities about it as well, because your employees hear it, your communities hear it, like it really starts to engage people in a brand new way. So you're not that far off now, and we're right with you on that one.
Yeah, I mean, even if you think about like the community benefit reporting that we do and weaving in kind of the value there, I think that's huge. So
when we talked about motivation early on, we had human health as a concern. Some was economics and consistency in patient experience, benefits to society. One of the questions here is, how do you approach decisions when the lower cost choice has a much higher carbon footprint?
Yeah, this is, again, this is where I think the goal of making sure that people kind of top to bottom in the other organization understand that this is a priority that needs to be considered is important, right? And so I've often, again, I would maybe reframe the question, because it's not just those two things. It's not just cost and carbon footprint. I'll pick on supply chain as an example. And I said I'd like to have the emissions right next to the dollar, but we already in supply chain make decisions that don't always mean choosing the lowest cost thing. Sometimes the lowest cost item is not the highest quality. Sometimes the lowest cost item, the lowest cost way to procure a lot of things in supply chain is to put all of your buying with one supplier, but that reduces supply chain resiliency. You're more subject to a shortage or something else, or some other sort of disruption. And so our people, once you get, like Rob's colleague who leads supply chain, or our supply chain leader here, once you get them into the work, then they can say they know how to make a balanced scorecard sort of decision. They don't blindly just choose the lowest cost. So what you need to do is allow for permission the framework to include emissions in addition to the other factors. So our supply chain team, yes, of course, always trades off on quality and cost every day, on supply chain resiliency and cost. They now trade off on emissions and cost, right? So it's all put into the same framework. Same thing with building, right? With building, it's a little bit easier for us to just go towards pick the thing that has the lower emissions, within reason, because like we've got these things forever, and again, within reason. As we continue, if we build something that's going to be bad from an emission standpoint and we're using it for 30 years, we're just shooting ourselves in the foot. But I suspected that question was a little bit more about some of the near-term investments, and I think that it is just permissioning the framework to include. The framework already has any decision that's made in the organization has a set of non-financial criteria. Make emissions one of the non-financial criteria.
All right, we're approaching, we have just a few minutes left, and I thought it might be helpful if each of you could just give 1 minute on what advice would you give to peers at other healthcare organizations just beginning to explore this work, just like a 1 minute response, if you could. Niyum?
I think I think we covered a lot of the things here. Maybe just channeling some of what each of us were probably batting around. I would say what anybody can do who's on this call is just force the conversation more, right? The more we are talking about this, and force it in a way that is cognizant of the business realities that your organization is operating under. And it relates again to that advocacy shift to accountability that I mentioned. The more people in the organization who feel accountable for your performance on this, the more good ideas will come up, the more you'll be able to make progress. And so that would be, probably my top recommendation.
Great. Brandon, anything to add to that?
No, I think that I agree. I think we made this kind of point, but getting the leadership across the organization, CFO, CNO, really CMO, like really across the organization, I think creates a different level of visibility and buy-in, because then as their kind of constituents have questions or raise opportunities, then that can they can be champions of it. So
Great. Rob,
Yeah,
anything
we
to
like
add?
to say, yeah, we like to say three things. One, be biased to action. Get started somewhere, like pick your entry point. It almost doesn't matter, but be biased to action. Two, work in a way that's culturally right for your organization. The way we did it is not right for other places necessarily. And if you do that, then you'll face the lower resistance to the work. You'll bring more people along. And then the third thing we would say is phone a friend. None of this work is competitive special knowledge that we have. If I call Niyum up and I've never met him before today, he's not going to shade his answers, to preserve their organization's position in the market. This work is so collaborative that if you take any time to start to build a network, you'll have an elaborate set of people that you can go to. And even if you build it across industries, it's stronger. So be biased to action, do what's culturally right for your organization, and phone a friend.
Well, Niyum, Brandon, and Rob, I want to thank you for your passion in this area and taking the time today to share your thoughts, very comprehensive thoughts with the group. I want to thank the group for your active participation. The number of questions and comments that have come in have made this a wonderful presentation. There are going to be other webinars on climate change forthcoming, and you can see those on the NAM webpage. Using this QR code, you can see some of that. Want to appreciate, again, everybody taking the time today and your active participation. Thank you.
Thank you, Mark, for your leadership and for surviving that earthquake.
yeah,
That was the biggest earthquake I've had since I've been in California.
Thanks all.
thanks.
Thanks.